Okay, so if you look at this again, this is a partially compensated respiratory acidosis. Why is it partially compensated? It's partially compensated because the kidneys, which control bicarbonate, are working in the right direction, trying to normalize that pH. So when your PCO2 goes up, the bicarbonate has to try to go up to maintain that pH. And because the pH is still acidic, right, because it's caused by the respiratory system, this is a partially compensated respiratory acidosis. Let's look at this. Terrible. Okay, so here are these blood gases. All right, look at the pH. pH 7.32. So that's lower than 7.35. So this is an acidosis. PO2, 80. O2 sat 82. So you want to give them some oxygen. The PCO2 is low. So low PCO2 is going to raise the pH, right? Because you're getting rid of more acid than normal. So this is really important. And almost invariably, when a patient's having problems, the pH disturbance that's going to be most prevalent is an acidosis, meaning it will either be a respiratory or metabolic acidosis. So always look for the acidosis, or clinically correlate depending on what's going on with your patients. But for the most part, you're going to look for the acidosis. So here's the acidosis. You got 7.32. Now, if you look at the PCO2 is lower than normal. And because CO2 is an acid, if you just looked at the PCO2, that pH should be alkaline, but it's not. It's acidic. So now you look at the bicarbonate. Your bicarbonate is low. And when you have a low level of bicarbonate, that means that the cells of the body, for whatever reason, are making excess amounts of hydrogen ions, dumping them into the blood, and bicarbonate's binding with them to lock them up. So you are decreasing the amount of circulating free bicarbonate. And because your bicarbonate level is low, right? And if your bicarbonate level is low, that is going to lower your pH. We know that this is a metabolic acidosis. Now, are the lungs helping out? Well, the PCO2 is lower than normal. So the lungs, in this case, are trying to help out. And they're helping out by getting rid of more carbon dioxide than normal. So if you look, right? If your bicarbonate drops because the cells are making more hydrogen ions and they're binding with that bicarbonate, and you're decreasing your bicarbonate because it's getting used up essentially, then the respiratory system has to compensate. How does it compensate? Compensates by getting rid of more CO2. So you're making acid at the cell, but you're also getting rid of more acid at the lungs. So the person will breathe faster and deeper. So in this case, if you look, we're looking, the PCO2 is lower than normal, right? But the pH is still acidic. So the lungs are trying to help out, but they just have not helped out completely. So this is a partially compensated metabolic acidosis. I know what you're thinking. Timmy, when are you going to show us a fully compensated? And guess what? Right here. So now you look at the blood gases here, right? pH. PM266, O2 sat, right? That's 84%. PCO2 is 72, and bicarbonate is 31. All right, so get these blood gases back on a patient. Look at the pH. pH is normal. So you don't go on break and then update your Facebook status with my patient's pH is normal. You look at the other values. PO2, O2 sat. It's low, so consider giving them some oxygen. Now, PCO2 is elevated. So, and the lungs, respiratory system controls carbon dioxide. So elevated PCO2 is going to drop pH. And what did I tell you before? Always look for the acidosis. So this is a respiratory acidosis, right? CO2, PCO2 higher than normal. Even though the pH is normal, that must mean that the kidneys, which is the only system that can compensate for that, for respiratory acidosis, how do the kidneys compensate? The kidneys compensate by reabsorbing more bicarbonate back into the blood. So our little nephron, you're not going to pee out that bicarbonate because the kidneys want to help out. So they will take the bicarbonate that was going to get peed into the toilet, bring it back into the blood, and excrete those excess amounts of hydrogen ions. And that's exactly what happens. So your bicarbonate is elevated, meaning the kidneys are helping out. And they are helping out completely because your pH is back to normal. So this is a fully compensated respiratory acidosis. And it's fully compensated because the pH is normal. These are the type of blood gases that you would see in someone with chronic bronchitis. They are chronic CO2 retainers, yet their pH of their blood is normal because, what did I tell you? The kidneys can correct any pH disturbance if you live long enough. So clearly these people are living. So if you know that the person has chronic bronchitis, then you want to be judicious in giving them lots of oxygen. In fact, you don't. You want to give them low levels of oxygen. And the reason you do is that you have these little peripheral chemoreceptors in the carotid artery and the arch of the aorta, and they respond to low PO2. So if you give them too much oxygen, their stimulus for breathing is not CO2 like ours is. Their stimulus for breathing is low O2. So if you give them too much oxygen, that will stop their stimulus for breathing. So CO2 elevated, CO2 is an acid, that drops your pH. But your pH is normal. Why? Because your kidneys are compensating by reabsorbing more base back into the blood. And because the pH is normal, even though this is a respiratory acidosis, pH is normal. So it's a fully compensated respiratory acidosis. And again, I mean, there'll be isolated cases where you'll get a metabolic or respiratory alkalosis. My point is that clinically speaking, look for the acidosis. And then again, you're not going to be interpreting blood gases in a closet for 8 hours. You are going to be interpreting blood gases based on how a patient presents. So you will use that other clinical information. But for the most part, look for the acidosis. All right, so get these blood gases back. And I'll give you a little bit of information. This person is a type 1 diabetic. In addition to the arterial blood gases, you get their chem panel back, and their blood sugar is 917. All right, they're sick. They got a fever too. So you look at them, right? You get the arterial blood gases. You look at the pH. pH, okay, it's normal. Don't go on break. PO2 and the O2 sats are low. The PCO2 is low. So if your PCO2 is lower than normal, CO2 is an acid. So you are getting rid of acid, right? So if you look at just the PCO2, that pH should be higher than 7.39. So something else must be going on. Now you look at the bicarbonate level. Bicarbonate level, high, low, normal. It's low. So the cells of the body are producing excess amounts of hydrogen ions and dumping them into the blood. What do you have in the blood? Our buddy bicarbonate. And they will try to buffer those, prevent those hydrogen ions from being free floating. The result is you're going to decrease the amount of circulating free bicarbonate. So this is an acidosis. And what's causing it is metabolism. So this is a metabolic acidosis. What's the only system that can compensate for a metabolic acidosis? The respiratory system. So, is the respiratory system helping out? And if so, how would it help out? Well, it would help out by, if your bicarbonate drops because the cells of the body are making hydrogen ions, you have a metabolic acidosis. The respiratory system compensates by getting rid of more CO2, more acid at the lungs. So you're making more acid at the cell, but you're getting rid of it at the lungs. So the person will breathe faster and deeper. And is that the case? Well, let's see. The PCO2 is lower than normal. So the lungs are helping out, definitely. Are they helping out completely? Yes. How do you know that? Because the pH is normal. So this would be referred to as a fully compensated metabolic acidosis. And I threw in the blood sugar of 917 and they're type 1 diabetic and they got a fever because these people are in DKA. The liver begins to make ketones that are acidic and dumping them into the blood because the brain can't use fat as fuel. And if you don't have insulin, you can't get glucose into the brain. So brain's got to use something. So the liver starts producing those ketone bodies, dumps them into the blood. They're keto acids, so that's going to drop your pH. And as your pH begins to drop, that's going to stimulate the respiratory system to try to compensate for that metabolic acidosis. So the lungs will breathe faster and deeper, trying to get rid of that CO2, which is also an acid. So you're making acid at the level of the cell, right? Those keto acids, and you're trying to get rid of it at the lungs. So they will get that Kussmaul breathing. So that's the Kussmaul breathing you see in someone with type 1 diabetes and who's in DKA. So what do you do for these people? Well, we learned that high blood sugar is going to draw water out of the cells and make them pee more. So their cells are going to be dehydrated. And why is their blood sugar so high? They ain't got no insulin, or they're very sick. And we learned that epinephrine and cortisol make your blood sugar go up. So you give them insulin and you give them IV fluids and you give them a hypotonic fluid to push that water from the blood into the cells to rehydrate those cells. And once the acidosis is corrected, then they should start breathing normally. See how this works? Yay. Tim Duke boys. Got my money. So this is in 2 parts because my kid came in and bothered me. So that's this will be the end of part 2. I hope it helped, and I'll have that posted online shortly.